Good morning and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. We're so happy you've joined us today. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today and also for these sessions. And we're so excited because we have the Honourable Minister for Health, Brad Hazzard, today with us to give a few updates on the budget as well as on some health initiatives. And we also have Ms. Liz Junck, who is the New South Wales Health Director of Community Care and Priority Populations, to provide information on palliative care initiatives. So before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and to Aboriginal colleagues who may be joining us in this session today. We also pay respects to multicultural leaders who are represented in this online session. For Minister Hazzard and Lisa and myself, we pay respects to the traditional custodians of the Camaragal people of the Guringai tribe of the Eora Nation. As we only have 45 minutes with the Minister and Liz, please, we'd request if you could please put your microphones on mute and ask the questions on the chat, and we'll get them answered by Minister Hazzard and Liz Junck. So thank you so much. We'll pass it on to Minister Hazzard. How are you today?
I'm very well, thanks, Jess, and good morning to all of you, and thank you for your interest in this broadcast and for being the people who we can rely on to time and time again to make sure that the multicultural community know what's going on in terms of the health issues. Look, I'll just make a couple of comments, Jess, and that is that obviously we had a very big health budget just in the last week or so. The health budget in New South Wales is now well and truly over $30 billion, and that represents very close to a third of the entire budget of New South Wales. So certainly very challenging to manage the big system that we have here in New South Wales, but it's also the system that has done a really good job. Many people, 140,000 workers in our health system who've done a very good job to try and manage the pandemic, this 1 in 100 year pandemic. Can I also just say quickly, and I'm happy to take questions in due course, that I definitely want, if you could, to make sure that your communities understand the importance of vaccinations. Still for COVID, we're still having quite a number of people with COVID. The figures are a bit indefinite. It's hard to actually pin down because a lot of people are now using rapid antigen tests and doing those at home or at work. And they are required, theoretically, to actually ring and report that or advise New South Wales Health that they have had a positive test. But we're quite aware that some people don't. So the numbers that we're seeing each day are an underestimate. There's no question, they're an underestimate. As at yesterday, we had just over 11,000 positive cases that were notified, but some pathology studies that have been done indicate that it could be double that number. So just if you can get the message through to your communities that COVID remains a big challenge. It's having an impact too on the health system. I think yesterday we had about 1,800 health staff that were furloughed. In other words, they couldn't come to work because they were positive for COVID, or perhaps were looking after a family member, but more often than not, it's that they are actually positive. The other aspect that's worrying at the moment is the convergence with influenza. Influenza is a very big challenge for us. You would all know that the last couple of years, because of what's been going on with COVID and the various measures that were taken, particularly closing our borders internationally, meant that we had little, well, actually no influenza as far as we know, but there may have been some that we didn't pick up. But it's fair to say on a broad population basis, it was not a matter of concern for us. It now is, and we're seeing a lot of people with COVID, with influenza, I should say, and particularly the little ones, the ones who've been born in the last couple of years have no immunity at all because they haven't been exposed to the various respiratory viruses and particularly influenza. So the message there very strongly is go and get your influenza vaccines. They have been free all of this month. And we are looking at the moment at the possibility of making it extend, although we're not sure whether that's feasible as yet. We'll make some announcements on that if we go down that path in the next couple of days. But it's important, no matter what the cost, whether it's free or whether it's a modest charge, you need to have the influenza vaccinations. COVID vaccinations are still important as well. Of all the people 16 and over who are eligible, there's about a third who have not had their COVID booster. So message, get the vaccinations. And on that note, I'll leave it now and pass back to Jess, and then we're happy to take questions in due course.
Thank you so much, Minister, for that. And please add your questions to the chat and we'll get the Minister to answer your questions. We'll pass it on to Liz Junck, New South Wales Health Director of Community Care and Priority Populations. And we've been invited to ask you about the palliative care initiatives that are coming up and as part of the budget that's been announced.
Great, thanks, Jess. And look, it's just a pleasure to be here to talk to you about palliative care and to talk about this amazing opportunity we have with the enhancement of palliative care services in this budget. I thought it'd be really helpful just to start with to talk about what do we mean by end of life and palliative care, because they're kind of terms that are thrown around, but not everyone really understands what we're talking about. And I think to talk really simply, it's end of life and palliative care is really about ensuring quality of life for people in the dying process at their end of life. Over 50,000 people die every year in New South Wales. Many of these people have life-limiting illnesses and they can really benefit from good palliative care at end of life. I think we put the emphasis so much on our start of life, good care at start of life. We talk openly about birthing and start of life, and it would be what we want is to see the same kind of discussion happening about good care at end of life. So palliative care itself is actually about treating the symptoms at end of life and managing those symptoms well. So that might be pain, it might be other distresses, discomforts that people are experiencing in the dying process, but also it's about the social and psychological care of people and their families and their communities in that stage. So it's a responsibility of everyone. While the health system implements clinical palliative care itself, we work with our partners in the NGO sector, our communities, our multicultural health communities, the private sector, primary care, right across a wide range of groups to deliver good care at end of life and to promote good discussion about the care people want at end of life and what their wishes are, and to break down, I guess, the stigma associated with death and dying. We need to make it more of a natural thing to discuss. So I think, with this budget, the most amazing thing is we have a huge announcement by government of $743 million over 5 years to invest in palliative care services. So this is really one of the biggest announcements ever, investments by government in this area. It will boost so many different spaces. We already spend about $300 million in palliative care annually. This is really going to significantly help us to ensure we are enabling choices for people about their care. We're ensuring that there is better access to care, and that we're looking at issues about equity, across the diverse needs of people, whether, what groups and background they're from, as well as where their location is. And that's really where the essence of the enhancements are. And we will be looking at our care in the hospital sector, improving models of care in that sector, looking at community-based care. Many people want to die at home. So how do we enable that and ensure that can be done really well? Looking at pain and symptom management. How can we be at the forefront of care around managing symptoms? We want to be doing that as best we can. A really important part of the enhancements is actually about how we engage with communities in discussions about end-of-life care. And that is a really significant piece that we'll be working on, and where, I guess, working with these the people online today and our multicultural health partners is going to be essential about that. There is also funding around improving our facilities in palliative care, And Nepean and Westmead in particular were mentioned in the enhancement, but there will be other considerations as well.
Thank you so much, Liz. And Minister, having you here, how valuable is this for communities, this budget for palliative care and for people from multicultural backgrounds?
It's actually extremely valuable. There was just taking up what Liz was just talking about in terms of what people actually want. Now, it obviously varies from community to community, but there was a very interesting report done back in 2014 by a group called the Grattan Institute. The report was called Dying Well. And what it did was it identified that the majority of people actually did, as Liz just said, would like to be able to die at home in their community with their family. But about 80% of people were actually dying in hospital. So what the New South Wales Liberal National Government have been focused on in the last probably 4 or 5 years now has been very much on how we actually enhance palliative care. I remember we had 20 round tables right across New South Wales about 3 years ago, I think it was, Liz, wasn't it?
Oh, longer than that, Minister, yes, a few years back now, which is brilliant.
It was on my watch, so it was certainly in the last 5 years or so, and what we found from that was that there was a big need in terms of reaching out to the community and also providing additional training for nurses who might be in areas that needed palliative care, but there were no palliative care specialists. So there's been a lot of work done, and that work has identified not just the need for the 300 million a year that Liz was talking about, but also this additional funds. So I think what we're hoping to do as a government is to empower local communities and individuals, families to get the support in community that they need. And it doesn't matter where you are. I know when I was in Broken Hill about 2 years ago, they were telling me that they had improved the capacity they had with the funding they then had been provided, so that a lot of people, particularly the Aboriginal community in and around Broken Hill, were getting very good services actually in their home. So that's the aim, and hopefully the multicultural community particularly will see that with funds coming to their non-government organisations, but effectively community partnerships with government, will enable a much more tailored approach to palliative care.
Thank you so much, Minister. And we've got some questions here. And just for everyone's information, we have on the chat some resources on multicultural in-language resources about the campaign's Little Things. We also have a link to the media release with the palliative care budget that's come through. So we have a question from Russell Anderson from NEMBC Media, Minister. What's the percentage of people have taken up the free flu vaccination, and when will we know if the free flu vaccination will be extended?
I was talking to Dr. Chant last night about this, and what we know is that there's nowhere near as many as we would hope. It's hard to actually give a statistical figure right now, because part of the problem is that although we get the reports back from pharmacists fairly regularly, the GPs are on an arrangement where they're going to be paid in another week or two, so we won't know what the final numbers are. But look, there's been a reasonable take up, but nowhere near what we need, and we'll make those figures available as soon as we get them, but I can't give you those specifics just at the moment.
Thank you, Minister. Mariam Murad from Women's Health Centres, she's saying that women's health centres have had no increase in over 30 years. Minister Hazzard, is there any allocation for early intervention for women's health centres?
We have actually been discussing women's health centres funding just in the last few weeks, and it is anticipated that there are additional funds that will come to women's health centres, but we're working through those. Obviously, Minister Ward also has a role in that. So at this point, all I can say is we understand the need and certainly looking to do what we can.
Thank you, Minister. And Liz, with the pandemic, just a question about what learnings have you found and how have you been able to apply this to the initiatives for palliative care?
Yeah, absolutely. Look, a hard time for everybody, and particularly a hard time for people who are separated from their loved ones, the visiting of loved ones in hospitals, etc., was obviously a major concern for people. I think a major learning there is about listening to our communities, making sure we've got ways of hearing what's going on, and also listening for solutions. And I think, you know, that is what we saw across a lot of districts, about local solutions to those, you know, to working within the requirements, but also being flexible around how we can ensure we're still looking after the, you know, emotional well-being of people during that time. And I think we need to apply that kind of thinking about being able to engage quickly, and also to apply that into anything new that we roll out. And palliative care is another one of those areas where that's a great place we can do that.
Thank you, Liz, and also having available health and language support for patients.
That's right, and I think that's where the solutions from the community really came about, what was needed quickly, and hopefully, you know, we were able to act on those translations, on getting those resources out where possible.
Thank you, and Minister, you've been there throughout the pandemic. And we were doing these media conferences, and having these language resources available on hand is key.
No question, Jess. What we did, we wouldn't have been anywhere near as successful in that first phase, particularly before we had vaccines. And of course, we tend to forget that for a whole year we were fighting a virus that we had no vaccine for. So we needed to work with the multicultural community, all communities. And I've got to say that the multicultural communities and the leadership in the multicultural communities was incredible. It was certainly a challenge, I think, for New South Wales Health as a very big organisation to be able to pivot down to those local communities when there was a major pandemic coming towards us, but they did it. And a lot of that goes to the willingness and the foresight of community leaders to be actively involved, to work with New South Wales Health, but also to work with their local community. We wouldn't have got the messages out anywhere near as well as we did if it hadn't been for multicultural media, but also community leaders. And I know I spoke personally to many of them, and it was obvious that we needed to do a lot to make sure that the information was available in the appropriate languages and in the appropriate form for particular communities. So I think the pandemic has been a positive in one sense, actually a positive in quite a few senses, a pretty awful period, but nevertheless some positives have come out of it. And certainly the focus on making sure that appropriate communications in the different ways. I mean, it's not always easy because some communities have come from places around the world where they haven't had a chance to actually learn to read and to write. So, and we learnt that along the way as well, so that we had to rely on oral messages as well, again, in language. So it's certainly been a big challenge for us, but I think we've had our health staff meet that challenge, but only because of the support from leaders of the multicultural community and the media in the multicultural community.
Yes, Minister, and just to support that, we've been able to partner with multicultural media in being able to develop those in language audio information for them to share with their audiences, which is great. We have someone who's a senior Aboriginal health worker, because aside from the multicultural media, we also have health workers who are listening in today. She's asking, Minister, she's from the Illawarra Shoalhaven community, is there any funding aimed at models of care that is culturally safe, trauma-informed care for Aboriginal and Torres Strait Islander care and support? And will there be funding returning patients to community country to land as they transition into the draining? And she's also saying, Liz, changing resources that do not use the word death or dying.
Yeah, so true.
Yeah, so Minister, any comments on that, and Liz?
Certainly we have in New South Wales Health the Aboriginal Health Unit here who advise the government on initiatives that are necessary. I also have had a lot to do with the Aboriginal community more broadly over many years. I was in fact the Shadow Minister for Aboriginal Affairs for, I think it was about 12 years, and have lots of Aboriginal friends all across the state. I was just up in Burke only about 3 or 4 weeks ago. I regularly go up there because I'm working on a project called the Marinuka Project, and I am very familiar with the issues that you've raised. Certainly in terms of the latter aspect, I think that still needs some work in terms of when people pass, whether there's some capacity to provide any support to families for the issue of somebody returning to country for their burial. As to the broader issue, certainly my understanding is there are funds available, but I'll ask Liz, are you familiar with the funds on that aspect? Because the technical aspects I'm not as familiar with.
It's definitely been an area of discussion for a while, and I do think there's also been some really good discussion between a range of government agencies about that issue. You know, not just in the health setting, because it's a broader issue than a like a health specific. So I know that districts do look to support communities in their wishes where they can around return to country. And I do know that we already employ a range of Aboriginal health palliative care specific workers. That was under some previous enhancements. And we will be expanding upon that as a result of this new investment. And these are the kind of things we want to actually be able to now really dig into and look at what else can we do? What are some other things that we can really push forward to ensure we are providing culturally appropriate responses to palliative care and end of life. I think the point about the language is massively important. I think when we went to do some translations and podcasts around end of life and palliative care, so many communities, there is no equivalent word to end of life and palliative care. So that's why it's important we need to always be looking at how to explain and how to support communities and engaging in those conversations and in the solutions they need.
Thank you, Liz. And also that's about co-designing and collaborations with communities.
Yeah.
Can I just add, the question, I think, is an Aboriginal health worker, please feel free to send any suggestions that you have to the Ministry of Health, the Aboriginal Health Unit within the Ministry of Health, because your suggestion, if you feel, it indicates you feel there's not enough being done in that area. And certainly I think your suggestions would be valued by the Aboriginal Health Unit. And as the Minister, I want to make sure that we're equitable on all fronts. So please let them know your ideas and thoughts on that.
Thank you, Narelle, and we hope we've been able to answer your question. We have another question from NEMBC Media. For the palliative care program over the next 3 years, imagine there's a role developed for multicultural media that could you tell us how they're able to help in any way? Yeah, for sure. Look, I think we have some brilliant examples already that we'd love to build on. There was a great partnership with SBS and some other providers in this space in relation to the podcasts and transcripts and other things that could be utilised locally to promote discussion about end of life and palliative care. Those are the ones we've got up on the website. We would love to then be able to look at how we engage with multicultural media to expand and scale up those sort of things, to look at other ways that we could be reaching and co-designing, with communities, communications that actually are meaningful to people and helps, spread a message that's appropriate around end of life and palliative care. So I think there's a massive opportunity, and I look forward to those discussions, about where we can do that going forward. Thank you, Liz. Minister Hazzard, key highlights of the budget include a bit of money to continue to the state's response to COVID-19, and this includes also for the COVID-19 distribution. How important is this amount of money to help with the pandemic?
There's no question that it's important, and that's why it's there. I think a lot of people have this view now that because our 11 a.m. press conferences have stopped and people have got back to a more normal life, that the pandemic has finished. It hasn't. There's a rolling average of about 15 deaths a day, and it remains a huge challenge for us. But we also have to strike the balance. As I would often refer to in those press conferences, we have to look at people's mental health and the economy as well, which underpins a lot of individuals' mental health issues. So the funds are there. They're there to try and drive both communication, but also the staffing that's necessary for the number of people who actually are still entering our hospitals. I haven't looked at today's figures, but I know we're usually sitting around about 1,200 to 1,300 people in hospital on any one day from COVID. That's in our wards. And we've had between 30 and up to about 50 odd people in intensive care units in the last few weeks. So COVID is still with us. And that's why, as I said earlier, it's so important that people who've had those first 2 shots go and get their booster. And if about a third of the population of 16 pluses have had no booster, the common sense thing is have the booster. And of course, if you're over 65, if you're Aboriginal or Torres Strait Islander, if you're pregnant, there's a number of different categories. Or if you're immunocompromised, you can have the 4th shot as well. So you certainly need to get whatever vaccinations you can have that you're eligible for, because it may not stop you. The Omicron variant and the sublineages, BA4 and BA5, are certainly challenging. They're very, very transmissible. And so it may not stop you getting the virus, the COVID virus, but it will certainly substantially lessen the chances of you passing away with the virus and also of being very sick with the virus. It won't necessarily guarantee it, but it will certainly help. So I can tell you, I've had every time that I've been eligible, I've gone and had the next dose of vaccine. The motto here is get whatever you can in the way of vaccines as quickly as possible.
And so I guess, Minister, that's what we're trying to tell the media, multicultural media, is to be able to impress that upon their audiences.
Absolutely. So to each of you, if you could emphasise that the vaccines are free, you can get them through your local pharmacy, you can get them through your GP. There are still major centres available through New South Wales Health, but we've moved to a more regularised model. Most people have a doctor or a pharmacist, and in some parts of the state, of course, there aren't so many doctors. But there is generally at least one pharmacist. So please emphasise to your community the need to go and get vaccinated. It really is such a significant message, and you will be helping to save lives.
Thank you, Minister. And please, if you have any questions, add them to the chat. Just Narelle just wanted to also add that can ambulatory services have acknowledgement of country in ambulances across the state? That's just a request that she's had. But I just wanted to also ask Minister about, you mentioned about mental health and services that's available. 36.4 million over 4 years for 57 mental health response and recovery specialists have been provided to provide assertive outreach support for palliative care as well as for COVID. This mental health has been a really important issue that we're trying to address across New South Wales.
No question. We have a separate minister who looks after mental health, who works with me as part of our group within the government, Minister Bronnie Taylor. And Minister Taylor and I have worked extensively in this area because the pressures that have come on to all of us, I think, have been quite extensive as a result of the last 2.5 years of the COVID pressures just from every different quarter. And what we are seeing is an increase in people needing mental health support. So the additional funds are aimed at doing that. There's a lot of work going on, particularly in regional areas, around peer supporters, so people who had lived experience of the pressures and stresses. And we will continue to do, as a government, here in New South Wales, whatever we can to support people's outreach to mental health support. But it is a challenge because what we're finding is there's limited numbers of psychiatrists and limited numbers of psychologists who are actually available to support us in this endeavour. But I think that if multicultural media could stress, for example, that if you went to your GP and talked to your general practitioner, there are Medicare that's provided by the federal government, Medicare available consultations that can be allocated with a psychologist. And look, we all have a tough time at some point, let's admit that, and getting that extra psychological help is crucial.
Thank you, Minister. Liz?
Yeah, no, I just reinforce what the minister is saying. It's definitely, goes across so many different areas, and it's something everybody's watching and needing to respond to.
Thank you. And also stressing that healthcare and interpreter services are available across local health districts to help support with in-language. Yes. We'd like to thank everyone who's asked a question. And I know that if there's any more questions, please add to the chat. But I wanted to ask as well about, Minister, when you said go to your GP, about the antivirals that's important for people to access when they do find out they've got COVID. And that's kind of the message that people are still not, some of the community are not getting, is that there are antivirals available for communities.
Yeah, look, the whole of the pandemic has been a progression. Our first year, we had no idea of how to manage many aspects of it. It was a daily learning experience. But the biggest thing that underpinned everything we were doing in some of the very challenging decisions we had to take, particularly around lockdowns that certainly I and Dr. Chant were not keen on, but we felt that we had to do it. That was a period where there was no vaccines. Just out of interest on that front, I know it's been challenging, particularly in some communities, but that year, in about March or April of 2020, I sat in a room with our health modelers who told me that in that first year alone, we would have 25,000 deaths here in New South Wales. As a result of the very difficult decisions that were made and the circumstances that we all found ourselves in with the lockdowns and so on, we ended up with 57 people who passed away that year instead of the 25,000 that were forecast. So whilst it was tough and horrible at various stages, for all of us, it did actually save a lot of lives. And then, of course, by 2021, we started to see the rollout of the vaccines, and the vaccines were the preventer. And it definitely had a huge impact. Earlier on, I think we had just the AstraZeneca, but then we had other vaccines that rolled out. What we didn't have was antivirals for the treatment of people who actually got COVID. And during the 2021, and of course now in 2022, we do have antivirals. It's important, though, that if you actually get the confirmation of a positive COVID situation, that you obviously follow your instructions that come from either your GP or New South Wales Health. If you have a PCR test or if you register your rapid antigen test, New South Wales Health will contact you and they will get details from you as to any other illnesses that you might have that make it even more problematic for you. But at that point, there can be some consideration given by your GP or by New South Wales Health as to whether or not an antiviral is necessary. Now, look, I had COVID, I think on the 5th of April, I got it. And even at my age, and with a few other illnesses that I've had over my time, New South Wales Health advised me that they didn't think I really needed antivirals. So it isn't automatic. I didn't get antivirals and I got through the week okay, a bit tough at various stages, and I think we all have to understand that it can be fairly tough on us. But your medical practitioner or New South Wales Health are the people who can determine whether or not the antivirals are appropriate for you. What I would say is the decision needs to be taken fairly quickly because it's usually in the first 2 to 3 days the antivirals are the most effective. So, and usually by day 2, you know whether you're going to get particularly ill, not always, but the symptoms tend to come on by about day 2, day 3. So be aware there are antivirals. They do actually diminish the symptoms and they can actually help you get through that period of the virus. And that's a big plus. So vaccines first to try and prevent it or to minimise the effect on you. But if once you've got it, there are antivirals that can be given to you. So worth talking to New South Wales Health, who will contact you about that if you think you need them, or your GP.
Thank you, Minister. And on your chat, we have the fact sheets in languages. They're in 57 languages, and plan ahead if you are at high risk, and also contact your GP if you are been tested COVID positive, and they're available in over 57 languages. And that's really crucial. Liz, your department, the Director of the Community Care and Priority Populations, you also fund all these resources for the Multicultural Health Communication Service and for refugee health programs. In terms of marrying all this for culturally and linguistically diverse communities, what are in line for your department in ensuring that multicultural communities and their needs are addressed in terms of communication?
Yeah, sure. Look, we have a wide range of policy frameworks already in this space, which are brilliant. And some of those are being revised at the moment with the input and engagement of stakeholders in that space. And that's just so important that we keep doing that and check in about what's required and needed. I think we're doing a lot of work around things like the healthcare interpreter service and opportunities there that we can be looking at going forward that will support all the range of health issues and health needs coming up through the system and for communities. I just think that the continued ability to have a two-way conversation about where we need to be changing or reconsidering in policy is super important. And we get that, from feedback from clinicians, but also through the community sector and the NGO sector. And it's going to be essential going forward, and it's going to be like a major priority space, I think, in any new enhancements or rollout, for example, like the palliative care space. So I have that opportunity of having a number of programs sitting alongside refugee health, alongside cold, multicultural health, to look at how we do make that alignment.
Thank you so much.
Jess, can I just add something back on what I said before, contact your GP. Of course, most GPs don't want you in the surgery if you've got COVID, but that shouldn't dissuade you or shouldn't put you off making a phone call and organising a telehealth consultation. Another good thing that's come out of the pandemic is that the federal government have now agreed that on Medicare, you can have a telehealth consultation with your general practitioner. And obviously they don't particularly, the GPs aren't too keen on having you in the surgery if you're positive for COVID, because you could give it to them or spread it to other patients. So don't arrive at the surgery, make the call, talk to the receptionist, say you're positive, but you'd like to have a telehealth consultation, and you can usually do it on your phone or on a computer, or even just on the phone, just a general phone call from a landline. So make sure you do it that way, otherwise you might get your GP a bit overly excited.
Yes, thank you, Minister. And it's telehealth and virtual care and language support is also available. Thank you so much, Minister. And just talking about interpreters, Multicultural New South Wales Interpreter Scholarship Program is currently open, and there's a shortage of interpreters in several languages. That's why Multicultural New South Wales has created an interpreter scholarship program. So applications are open until Monday, 11th of July, and you can find out more from the Multicultural New South Wales website. But also, as Liz has announced and mentioned, and we mentioned here before, the healthcare interpreter services are available for all patients and consumers across local health districts, and the responsibility to book an interpreter lies with a healthcare practitioner, and you can ask for that. So that's available on the New South Wales Health website if you needed it, and we're a state that provides that healthcare interpreter service that's uniquely to New South Wales. But we've almost run out of time, but I would like to ask the Minister to say any last words for our multicultural media and health workers who are online today.
Look, health workers, just a big thank you. Obviously, without you doing what you've done in the last 2.5 years, we wouldn't have such a positive outcome, and we wouldn't be having the freedoms we've now got. To the multicultural media, again, thank you. You're amazing all through the pandemic. And I value everything that you have done and will do to get the message out to your community, because many in the community are still in need of knowing exactly where we're up to with this, and to understand there are still some risks. So if any messages you can get across to your community, I'd be very grateful.
Thank you so much, Minister Hazzard. And Liz, any last words?
No, just thank you for the opportunity to speak today. I think it's been great to be able to put this area of palliative care on the agenda, and also to hear that there is definitely an interest from multicultural media in assisting with, communication and messaging that'll help us get better outcomes in the community. And a big thank you also to all our multicultural health workers. I look forward to engaging with you further.
Thank you so much. And thank you so much, Minister and Liz, for being with us today. We'll see you in the next fortnight. Our next online conference is on July 13th on Wednesday, and that will be the same time, 4 to 4:30 in the afternoon. The recording of this briefing is available on the New South Wales Multicultural Health Communication Service website, and we'll send you some links to the resources and the recording of this in your emails. So thank you so much. Have a great afternoon and stay safe.